Yes, children have the experience as well. There was some research to say that children didn't have a life review as well, but yeah, they do get a life review. Obviously, it's not as detailed as an adult experience, but I've recently had communications with a lady who had an experience when she was quite young, and she still remembers bits of her childhood from interacting with her small brother as well, you know. Again, with children, they tend to see pets as well. So, yeah, I think they've got kind of less people around them who have died as well, really, if you think about it. So,
So, when you were working at the hospital, did you get any grief from the people above? What are you doing? Leave these people alone?
well, surprisingly, no, I didn't. Again, when I had to do my research, I had to go through the ethics committee and I had to get a lot of permissions. It was a lot of red tape to actually get the permission to do the research.
Oh, it wasn't just tea and biscuit by the bed.
No,
can I quiz
it was,
you?
You know,
Can I quiz you while I was not here?
No, it was a proper, thorough investigation. So I had to go through the ethics committee. And then, in fact, the consultants who I worked with, the doctors, at first I didn't know how they were going to receive it, because they could have easily said, oh, no way, you're not doing that. But they were really open-minded to it, and they could see that it was for the benefit of the patient because we were getting a deeper understanding. The only thing people who had the near-death experience the only thing they had in common with each other is that their brains weren't functioning as they would do normally. So they were unconscious for some reason, whatever that reason is. Okay. And again, that made me think, well, consciousness, if the brain produces consciousness, these people were unconscious, how could it produce a state where there should be no consciousness, If you have a cardiac arrest, within about 10 to 15 minutes, your EEG on your brain, the brainwaves go flat, so you shouldn't really have any conscious experience. But what these patients were reporting was a heightened state of reality. What they said is realer than real. It's nothing dumbed down or damped down. It makes more sense to view the brain as a mediator of consciousness. And so it perceives consciousness, and I think the brain acts like a kind of filter. And usually this heightened state of reality or this consciousness is screened out of our everyday waking reality. But I think there are times in our life when that filter expands or relaxes and this heightened state of consciousness is allowed into the everyday consciousness. So, examples of when that can happen is during a near-death experience, when people take certain kind of drugs, mind-altering drugs like DMT, ayahuasca and things like that. All those sorts of drugs can relax that filter a bit as well.